I'd like to welcome everyone to our virtual NIA Center event. Thank you so much for joining us. And I'd like to share a little bit about the NIA Center. We are a nonprofit 501c3 organization that is leading the way in working toward placing an African American cultural center in Grand Rapids.
That was a great practice run.
Yep, we have not started yet, Robert.
No, that was good.
Barb will let you know when to start.
Yes. Hello, everyone. My name is Robert Upton. I'm the chair of NIA Center, and I am so thrilled that all of you have joined us for our Virtual Connect event. We're going to be holding these events on a monthly basis, and I think you are going to enjoy our lively discussion that's going to take place today. And I think you will enjoy seeing some of the speakers that are going to be joining us in the future. So welcome and enjoy this Virtual Connect event. I want to tell you a little bit about NIA Center's board. We are thrilled to have, of course, Sandra Upton on the board, Barbara Welch, and the founders of our organization are Ruth Coleman and Wayne Coleman. Now I want to talk a little bit about the vision of NIA Center. The vision is to become a world-class cultural center that will be the foremost destination, resource, and opportunity for sharing and expressing African American culture. The mission of NIA Center is to provide an inclusive gathering space created to inspire, build, transform, and connect all people of all ages. And we are going to have some exciting announcements coming in the near future. So I want to encourage you all to visit our website on a regular basis, and you're going to see some great information that's going to be made available fairly soon to each of you about our future plans. Now I want to talk about the pillars. These are the 4 areas that are critical for NIA Center. Our goal is to inspire, it is to build, it is to connect and transform this community. And now I want to talk about the 6 focus areas. They include the arts, diversity, inclusion, and racial equity, education, entrepreneurship, and wealth building, healthcare, especially as we focus on health disparities and equity, and research. So with that, I am delighted to introduce our awesome panelists that we have with us tonight. They include Dr. Jason Slaikeu and Dr. TaLanda Bragg. And so I would like for both of them, starting with Dr. Bragg, to briefly introduce themselves and tell us what they do at Spectrum Health, and share with us any other appropriate affiliations that they have.
Hi, I'm Dr. TaLanda Bragg. Thanks for having me here. So good to be around my people to share some important information. My job is as an internal medicine hospitalist, which basically means I take care of sick patients when they're admitted to the hospital. I also serve as our residency program director for the internal medicine program. So I have the awesome privilege of training our up-and-coming internal medicine physicians. And I'm affiliated with Michigan State University's College of Human Medicine as a associate clinical professor.
Wonderful. And Dr. Slaikeu.
Yes, it's good to be here with all of you. I'm Jason Slaikeu, a vascular surgeon in training. Actually, I'm a general surgery trained, and then I did a fellowship in vascular surgery where I operate on the blood vessels. And I also serve as division chief, overseeing our vascular surgeons at Spectrum Health, and currently also Vice President and Department Chief of Orthopedics at Spectrum Health. So
Okay.
I spend about 1 or 2 days a week in the operating room and seeing patients and doing administrative work with the rest of the time.
Wonderful. I should mention, as we begin to get into our questions, if you have any questions that you would like to ask our panelists, please put your question in the chat box. And in the last 15 minutes of our discussion, our panelists will respond to your questions. So tonight we are talking about a very important issue that especially the African American community has been facing with COVID-19. It has disproportionately impacted our community. And that's one of the reasons why we felt tonight it would be appropriate to start by looking at this important topic, especially as it has impacted our community. So I'd like to begin by asking the first question, and I'd like to pose it to Dr. Slaikeu. What exactly is COVID-19, or is more commonly referred to as coronavirus? And how does someone contract this highly contagious virus?
Sure, great question. It's something I think a lot of us have seen in the news and are aware of. But it's coronavirus is a new COVID is a new kind of coronavirus, and we've had coronavirus. But this is a different version of it, and this is a virus that emerged from China in December 19, which is where the 19 from COVID-19 comes from. And this is a virus that it's contagious. It spreads from person to person. It's usually spread through droplets from a person's when they either cough or sneeze, and those droplets can be inhaled and go into the eye, and the person can become infected. And so because of the fact that it spreads through these droplets, it's why social distancing is important. One of the reasons why this is such a concern is that we just in our community humans just haven't had the immunity for this to this virus, and so that's why it's wreaking so much havoc to many people.
Thank you so much. Dr. Bragg, what happens when someone contracts the coronavirus or COVID-19? And what do you do to help treat anyone that has become infected with this deadly virus?
I think that's the interesting thing that we're finding about coronavirus is that it can present with a wide variety of symptoms. It can look different in different people depending on, what their general health is. So you can have people that don't have symptoms at all. You can have people that have mild flu-like symptoms like runny nose, a little bit of cough, fatigue or fevers. You can have diarrhea, GI symptoms. It really can be a wide range. The thing with COVID is everybody that contracts COVID won't be significantly ill. In fact, most people that get COVID will probably be able to manage their symptoms at home. But there is a subset, maybe about 20% of the people that contract COVID that end up progressing where they need help in the hospital managing their symptoms. And usually that involves severe shortness of breath and a viral type pneumonia, which can actually lead to respiratory failure, meaning you need breathing support on a ventilator. I do want to say that of the people that gets ill, the people that really get sick with coronavirus are those that have underlying medical issues like comorbidities or chronic illnesses that they're managing. So things like obesity, high blood pressure, diabetes, asthma, COPD, or lung issues. Those are the people that we're really seeing get sick. Now, as far as how we treat these, like I said, most of the people that have coronavirus may be able to manage their symptoms at home, with over-the-counter things like Tylenol for fevers or cough medicine. But those that are sick enough to come into the hospital, again, we're doing supportive care, maybe giving them extra oxygen to help them breathe. And at Spectrum Health, we've been very fortunate to be on the front end of a lot of the experimental therapies, meaning therapies that there's some studies and we think they work, so we're trying them. And that's like antiviral medications and something new called convalescent plasma therapy. Dr. Slaikeu talked about coronavirus being new to us and we not having immunity. That's why it makes us so sick. But we found that if you take somebody that had coronavirus and they recovered from it, their body made immunities or these antibodies. And if you take that blood and give it to somebody that's really sick, you almost boost their immune system by helping them fight it off. And at Spectrum, we've seen that there are some benefits to that.
Very interesting. Spectrum has always been on the forefront of addressing these types of issues. And Dr. Slaikeu, I'd like to ask you a question. You know, how is COVID-19 different from other viruses such as the common flu, H1N1, swine flu, or Ebola?
Yeah, so we're still learning a lot about this virus, even though it's been around for a little while. But one of the things that we've seen with COVID-19 is that it is, we believe it's worse than the flu, just simply from when we look at the death rate. It's just significant when it comes to COVID-19. And one of the challenges with it is that it actually is quite similar in many ways to the common flu. Some of the symptoms that Dr. Bragg talked about, are very similar to COVID-19, between COVID-19 and the flu, and makes it hard to sometimes distinguish, and sometimes people will sit on it and not get treatment and care, and that can create a real challenge as it relates to people still spreading it. It's interesting in that the common flu can sometimes you oftentimes will have symptoms, but with COVID-19 there are many times that people are asymptomatic and don't have symptoms at all, which really creates a challenge in that people can have it for a number of days without having symptoms, or may not ever have symptoms, and still be able to transmit it, pass it on to other people, and other people that get it can have a very very significant death rate from it. So it's a challenging one in that we're still learning about it. It's very similar to the flu-like symptoms in some ways, but yet it is very different in terms of the death rate. We do feel, and as you can see across the country, that the number of people that have been affected in a short period of time, it's substantial.
Yeah, I do want to say, Dr. Slaikeu mentioned a very important point about how it's transmitted. When people have the flu, it. It's no question about it. You have shake and chills and cough, and you feel bad. But again, people with coronavirus may just have a change in their taste or loss of smell, and something so benign you probably wouldn't even think twice about it. But yet you go along your day. So if you're not doing those things like wearing masks and social distancing, it's a chance that you can possibly be making other people ill.
Dr. Bragg, I have a question for you. A lot of students are going back to school, and we have a lot of parents that are really nervous right now. And we have a lot of school systems that are grappling with what do we do, even though, guidelines just recently came out. My question to you is, number one, we don't see as many young people coming down, when you look at percentages with COVID-19, but yet still they can catch this virus. And so I'd like to have you comment on what type of preventative measures should parents take as you think about it, from a medical perspective.
Mm-hmm. Honestly, I really think it is a culture change. Just like you teach manners, you got to kind of teach this new way of life with getting them to do these things consistently. And of course, role modeling makes a difference too. You know, they should be seeing you wear your mask, see you washing your hands frequently. So I would just emphasize those things that we know, because, you know, it's not realistic to think that we can be on shutdown forever. Right? It's not realistic
Right.
to think that we don't have to navigate these spaces, even like the grocery store or the pharmacy. So if you do these certain things consistently and teach your children and teenagers the importance of social distancing, the wearing the mask when you're on inside, and create this new safety culture amongst the students, they really are the ones that can prevent this significant spread once school opens up. So it's almost like saying, hey, this is just how it is, let's do it. And then also bringing home the point of that altruism of doing it for the community. Yeah, even if you get COVID, you might not have symptoms, but you're coming home to mom and dad, or you're coming home and to grandma. You know, it's this community thing that's really different for us as a society, but it's extremely important in every arena, for us at work, for you at work, and for kids at school.
And I would just add, you know, I agree with everything that was just said there. You know, it's, you know, these are opportunities I think that we have with our family members, with children, with teenage students, to really talk about the impact of what they do on other people's lives. You know, to just support what Dr. Bragg mentioned. This is an opportunity for people to think beyond themselves, to think about their communities, think about their families in new ways. And I think we can continue to take those opportunities to teach and learn about how we can impact people. It's very clear that social distancing, washing hands, being you know, wearing a mask, these are things that are clearly impacting people's lives and impacting the death rate. And so we need to be socially responsible about that and be able to teach that social responsibility.
Dr. Slaikeu, I'd like to ask you this question. I know seniors have been really impacted by COVID-19 substantially, especially when you look at the deaths that have taken place at nursing homes across the country. Why are seniors more susceptible to COVID-19?
Yeah, you know, it's a great question, and it's something that oftentimes people ask about. And you know, seniors and young people are susceptible, and it's not as much that seniors are so much more susceptible as much as it is that seniors tend to have more comorbidities or other disease factors that make it more difficult to fight off the infection when they get it, and to fight off you know, for example, if a person has lung disease, that can and we tend to see that in seniors more often than in young people. They will have a harder time with being infected with coronavirus. So a lot of it has to do with the comorbidities and other factors that have weakened the individual, so that when they do contract the coronavirus, that it's harder for them to get through the disease.
Dr. Bragg, I have a question for you. What can the African American community do to address some of the health disparities that really are serious issues for our community? And I'd like for you to comment on some of those, and then talk about what are some preventative measures that we can take.
Mm-hmm. So healthcare disparities it's a very, very different or difficult topic. You know, it's somewhat of a loaded question, because we know that there are several things that go into making somebody healthy or well. You know, it's not just going to the doctor or having access to care, but it's also who you are, where you live, your community, your environment, your economic stability, your education, your literacy level, your housing, your food, and your food security. And then there's racism and implicit bias and things like that. So it's very complicated. So all these things together cause the healthcare disparities and the general increased comorbidities or illnesses in a lot of our communities of color. So when you have that, you have generally people that aren't as well, people that are succumbing to end-stage complications of common medical illnesses that are pretty easy to treat. Like, we know a lot about diabetes, we know how to treat it. We know a lot about high blood pressure, we know how to treat it. But connecting the dots, because all of those social factors sometimes can be difficult. So what needs to happen really, I think, on a systemic level is addressing some of these issues and getting really to the root of the problem, you know, and a lot of that involves community engagement in every area, in every institution. But given that that's kind of a tall order to fulfill, I think on an individual level, I always encourage people to try to be as healthy as possible, try to advocate for themselves, always ask questions. And it's not just about having a doctor, but it's actually about engaging with that physician. You know, if you have questions about certain things, being willing to ask. If you know medical professions, being humble enough to ask, you know, if they can help advocate for you. And then there's the personal things that you can do with activity levels, diet, and managing those medical issues. You know, it's not the diabetes that kills, but it's the not tending to the diabetes that leads to end-stage complications like heart attack, stroke, kidney failure, dialysis. And we know people with those medical issues succumb to more end-stage complications. And we know now that those are the people that really are getting really sick from COVID-19, and those are the people that are dying from COVID-19. And unfortunately, we've seen in Kent County and in Michigan as a whole, that it's been our communities of color that's been significantly impacted disproportionately.
Yes. Dr. Slaikeu, can you talk briefly about how COVID-19 has impacted African Americans in West Michigan? What have you been hearing?
Yeah, so really an important question to ask, and it's something that we've seen in, you know, disproportionate level of infection rate to African Americans, and we know across the country actually that the death rate from COVID-19 is higher, disproportionately higher among African Americans than it is the others that other populations, Caucasian populations. So, and again, it has a lot to do with what Dr. Bragg mentioned, is the comorbidities being a part of it, and there's a lot of social issues. We're talking even you can get to the political issues and just personal issues as well. So we have seen disproportionate level in also Latino populations. We've seen a significant number, and locally here in Grand Rapids, we've seen even though we have, for example, in Kent County, we have 11% population who is African American in this population. We're seeing significantly higher number of patients who are African American who are getting the coronavirus and succumbing to it. So this is something that we've recognized at Spectrum Health. This is something that we've seen across the country, and it's really important for us to educate, you know, the community about what we can do to try to curb that and narrow the gap, if you will, and eliminate these disparities that we see actually in other diseases as well. And that's why I think that I'm thankful that you're doing this kind of work, right? The NIA Centre is looking at how we can reach out to the community and provide the education so that we don't continue to see this gap.
Absolutely. I would like to add another thing worth mentioning is just how complex it is. Because in the beginning, when we were saying, well, we know to stay home, to stay safe, you have to stay home. And sometimes we forget that that's not a luxury for everybody. You think about the essential workers and the public facing people. Unfortunately, again, it's disproportionately that people of color hold those positions. You know, you think about bus drivers. You know, I'll never forget the story that was in Detroit about the bus driver that made a video on Facebook how he was frustrated that people were getting on the bus and coughing. And then sometime later, he succumbed to that and actually died from COVID. So, you know, you think of your grocery store workers and, you know, your bus drivers, service workers. Everybody can't have jobs where you can work from home. And when you think about having health insurance and being or needing to eat and actually having to work for a living, that was a significant factor too. And Dr. Slaikeu mentioned an important thing about education and literacy. I'm pretty proud of Spectrum Health in that they put out information early and translated it into like 5 different languages, and even did these community outreach videos so that, you know, these communities of color really have people speaking to their issues.
Yeah, and Robert, I'd just like to add, just to kind of drive home the importance of this. You know, we've looked at some of the data in Kent County. I mentioned to you that, you know, 11% Black population in Kent County, but yet we're reporting right now nearly 17% of the patients that we're seeing that with positive tests are Black. We're looking at in Michigan, 40% of the deaths are in African Americans, despite only 14% of the population is Black in Michigan. So, you know, 32% of positive cases in Kent County are within the Latino population, despite the, you know, 11% you know, Latino population in the county. So, you know, these are significant, you know, numbers. I think this significant disparities, which is again highlights the importance of the work that we're all doing here.
Yeah, just what you said, it is very disturbing when you look at those statistics, you know, and the impact, especially on African Americans and people of color.
Yeah, I do. Oh, I'm sorry.
Oh, please.
No, I was just going to mention just a really important thing that our Michigan government did. They saw this trend very early, and Dr. Khaldun actually sent out a letter to all of the licensed healthcare providers in Michigan saying, yes, these disparities are real. Yes, we see them. So you need to pay extra attention to these communities. And if they have symptoms, screen them appropriately and make sure they have access to resources. And she also brought up the idea of implicit bias, saying, hey, we need to stop and look at ourselves and make sure that we are treating people equitably, you know. And I think about when we had a scarcity of resources, right? You can always tell equity when resources are scarce, when you can tell who's actually getting those things. So when there weren't testing, we saw in Metro Detroit that many people were being sent home that probably should have been admitted to the hospital. There's a story actually in a free press that was shared again with USA today, where there was a gentleman that died in his home after being turned away 3 different times from 3 different hospitals. So he died in his recliner at home, and nearly all of his family had COVID. So as a healthcare system, now it is a law that every licensed provider is mandated to do implicit bias training.
Wonderful, wonderful. Yeah, because that is definitely a factor in this discussion, and it's very complex when you look at all of these issues, you know. And Dr. Bragg, I really like how you weaved in the fact that a lot of our African Americans and people of color are in the service industry, you know, and so their potential for being exposed to the virus is higher, you know. One of the things that I read earlier today too was in housing, especially in urban communities, the housing populations tend to be more dense, The opportunity to social distance is not always there. Can you comment on that as well?
Oh yeah, absolutely. I mean, we're a social people. When people get sick, you go sit with them. You check on them. You bring them soup. You pray with them. We gather. You know, that's our culture. When we're happy, we get together. When we're sad, we get together. You know, so that is one of the barriers initially. You know, how do you tell somebody who, you know, has their mother living with them and their mother falls ill to, hey, keep your distance, you know, so there were some barriers from that standpoint. And then this really hit our Hispanic community in West Michigan because culturally it's not unusual to live in multi-generational households with uncles and aunts and grandmothers and things like that. I had a patient that we had to discharge and he had 10 people that lived in his home. So how do you discharge somebody with COVID and explain this social distancing? So that is definitely something, and you do what you can, right? You utilize your community resources, you seek alternatives as far as housing, and then you just kind of have to indoctrinate the importance of those simple measures like wearing masks. You know, we know if 2 people wear masks, that significantly decreases the risk of contracting COVID, even if one person has it and the other person doesn't. So frequent hand washing, sanitizing surfaces that are used often, like doorknobs, sinks, things like that, hard surfaces. So those simple things that we can do, we just really try to stress those things. But I agree, the more dense population, you know, it's not just the economical thing. Sometimes it's just a cultural thing that we have to overcome. And that's why education is extremely important.
Dr. Slaikeu, as an African-American male, I would love for you to comment on this. I've read some information that some African-American men in particular feel uncomfortable putting a mask on because of the negative stereotype in the past that we, you know, in terms of people who were going to commit a crime wearing a mask. Can you comment on weighing that against, from a public health perspective, protecting themselves, keeping themselves safe and their families and their loved ones? Can you comment on that?
Yeah, that's a great question. It's something that I felt myself a little bit. I remember when I was first, and I wear a mask all the time in the operating room, but you know, when I'm out and about, you know, it was just such a new thing, and I've heard other people talk about that. I think it's becoming less, a little bit less concerning now because it's so widespread now that, you know, people are wearing masks. So I think that it just with time is diminishing. But again, it's you know, you talk about the idea of just protecting yourself. Yeah, it's important for that, but it's also important for protecting others. You know, again, you can be asymptomatic, have been exposed and not know it, and have contracted COVID-19, and be asymptomatic and think you're fine, and be infecting other people. And I bring that up again. It's just it's not just to protect yourself, to protect others as well. So, you know, it's a socially responsible thing. I think now, you know, that concern is probably going to continue to wane as it's just so widespread now, the use of masks. But we still need to continue to encourage people to do that and overcome that concern.
Dr. Bragg, I have a question for you. We've seen these scenes of young people going to beaches in Michigan and to Florida and other places, not wearing masks, not socially distancing themselves from one another. We know that young people are on their way back to college. They're on their way to high school and, you know, and K through 12, all of that. What would you have to say to our young people, given that COVID-19 is still with us? It's going to be with us for a while.
It has not gone anywhere, and this is our new way of life. And the only way to continue in society is to do what we can. Everybody has to do their part in masking up. You want to stay in school, well, you gotta not have these, super spreader parties, so we're seeing enough examples. There was even a recent thing with a residency program where 17 or 18 anesthesia residents had a welcome party and they all got COVID. 18 residents. Can you imagine what that does to the physician workforce at that hospital to just take out 18 physicians? So now we are really seeing all of these examples. And the more that you mention it, the more it comes in the media. Eventually, people will begin to believe that fat meat is greasy. It is here, and we really got to monopolize on the fact that there is no easier way to save a life than to simply put on a mask, keep your distance, wash your hands frequently, so that we buy ourselves time, so that while we're waiting for vaccines to happen, more people aren't dying unnecessarily. At this point, I can say that almost everybody in Michigan, especially in communities of color, either knows someone that's had COVID, or whether it's a distant friend or a close family member. Like, we've all been touched by COVID. And unfortunately, it's looking like a lot of us have to somehow have some personal experience with it in order to really have that impact to say, look, I care about my grandma. I've seen somebody pass away from this. What can I do? So again, Dr. Slaikeu mentioned it a lot of times, it is about teaching social responsibility, just like you teach manners, just how you teach, don't cough in people's space. It's one of those simple things where we just have to keep saying it over and over and over again.
Dr. Slaikeu, what do we know about COVID-19 and its impact in our communities of color that we didn't know when it first started? Anything come to mind?
Yeah, I mean, there are a number of different things that we've learned about. I can remember when we first started seeing this especially over in Washington on the kind of on the west side of the states, and seeing what was happening in Italy, and we were learning tremendous amount through social media outlets, and just trying to figure out what it was that about this disease because the word is traveling so fast, but it's faster than what we could really, textbooks and all that obviously can't keep up with that. So, but one of the things that we've realized is how damaging it can be, and how the death rate is significant. We've realized very clearly that we can impact this curve. We can flatten this curve, and through behavioral change, right? We can do that through the mask, through the social distancing and washing of hands, and that. So that's something that we've been able to understand and know. We've also seen a lot of we've learned a lot medically, through seeing patients in the hospital, how they respond to things. Things such as increased rates of blood clots in the lower extremities, or increased rate of stroke, some of the long-term effects and symptoms that you can have from coronavirus. The rate of the fact that children, for example, are susceptible to getting it and transmitting it. They don't tend to be as affected by it in terms of the death rate, and symptoms don't tend to be as severe, but they certainly can transmit it, and that's very the literature shows that. So I would just highlight that we've continued to learn more and more on a regular basis. Every week we're learning new things about the virus.
Dr. Bragg, can you comment on access that African Americans, especially within the urban community, and have to testing? And we know that was a major issue early on. They were saying, hospitals were saying, we need more testing kits, we need more resources to be able to test vulnerable populations. How are we doing? And are African Americans gaining more access to testing if they suspect that they or think that they have the virus?
We are very fortunate to be in Michigan. I will say that I've been super pleased with how our government has been handling things with ramping up resources and now the availability of testing. We've seen the different healthcare systems across West Michigan come together. I was super proud when Mercy Health, for instance, they tested all the people at Mel Trotter, you know, and when you think about populations that are in close quarters and not necessarily having that ability to social distance, those are the people that are at significantly higher risk. There's been testing drives with Cherry Health. Spectrum Health has a free COVID line where you can get free testing. You can do virtual screening. So here in West Michigan, it's actually pretty easy to call up for testing if you're exhibiting some symptoms.
Dr. Bragg, can you just share a little bit about what does that testing look like? And what, I know some people had indicated early on that it was a little bit uncomfortable, but they've come up with other forms and ways of testing. Can you comment on that?
Yeah, the best test really still is the uncomfortable one. Basically, there is a long nasal swab that they put through one nostril and they go all the way to the back of the throat and swab right there. And then they do the other nostril too. And you have to do it for about 10 seconds per nostril. That's where the virus lives when you have symptoms. So you really have to get a good sample or else it's a possibility you can have the disease and actually not detect it, meaning you having a false positive. So yeah, that's basically the test. It's called a PCR test, and they run that sample. Now, you may have heard of other testing that's available, and that's a blood test. That's that antibody test. And all that tells you is whether you've been exposed to COVID-19 enough so that your body creates defenses or antibodies against it.
Okay. Dr. Slaikeu, it seems like this coronavirus pandemic has been going on longer than we would have ever hoped for. And it doesn't seem like there's no date that we can look at and say for certain on the calendar that this is when it's going to be over with. My question to you is, how close are we to developing a vaccine? I know that I've heard that there's a number of companies that are really making a substantial progress, but realistically, how close are we? I wanted to pose that question to you.
Yeah, it's just, it's a great question, often asked. I was reading an article just recently about this idea that's, it's kind of an op-ed article where they basically mentioned, coronavirus is here for, for forever. It's something that clearly is we're continuing to see tremendous infection rate across the world. And this question of a virus is something that's often at times in the news. And one of the things that I think is hard to, for some people to wrap their head around is just the length of time it takes to actually develop a vaccine. It's, there's a tremendous amount of work that goes into it. There's different stages that when you look at the actual steps to making a vaccine, you have to do this the genetic sequence of the virus, then you have to develop the vaccine using a number of different strategies and get volunteers and trials, and then once you do a round of clinical trials, then you got to expand those clinical trials to larger populations, and then and finally get to this widespread use after it's been proven and to be safe. And we've seen this where in other times where you can if you don't go through that process, you can have people that can be in harm's way down the road. If you don't appropriately vet it. So there's different phases to creating a vaccine. There's this what we call preclinical phase. There's a phase 1, phase 2, phase 3, and then there's this whole idea. And then finally you get to approval. Right now, in terms of vaccines that are not yet in human trials but are in this preclinical phase across the just as of just earlier this month, there's the World Health Organization published there's about 138 of these preclinical trials. So when it comes to phase 1, which is vaccines that are still small scale trials, there's 25. So we got 25 in the phase 1. In the next phase 2, vaccines with expanded safety trials, but not yet approved, there's 15. In phase 3 with vaccines with large-scale efficacy trials is 7. And then the number that are approved, which is where we want it to be, is 0. We don't yet have that. So, we have this pipeline. The work is being done. But we just don't know when that approval will be there.
Yeah, so that's why, again, I know it sounds like I'm being repetitive, but that's exactly why it's so important that we make these things that can prevent the spread habit, okay? And a consistent habit of frequent hand washing, not touching your face, wearing your mask when you're in public, and social distancing, right? Because it's not just getting a vaccine that's approved, it's distribution of it. Millions and millions and millions of people have to get this vaccine in order for us to really get a handle on coronavirus. And then once you get the vaccine out, then there's observation the following year of what happens. If you think about the flu, for instance, just for comparison's sake, for vaccines. Every couple of years, the flu mutates significantly, but every year we adjust our vaccines based on the previous year's strains, right? So there's constant reworking, and we won't know whether a vaccine is truly effective at significantly reducing the spread until millions of people have been vaccinated. And how do you get enough vials? How do you get enough, product? And how do you get it into these areas? Even now there's starting to be discussion about how do we target our most vulnerable populations. You guys will probably remember where there has been flu vaccine shortages. So the older people in nursing homes got the vaccines first. The people with, on chemotherapy with weakened immune systems. And now people are even saying, should we be looking at communities of color, knowing that their mortality or more of them die when they get COVID? So it's interesting. We're a long way off. So again, social distancing and wearing a mask.
I even heard that perhaps more than one dosage might be required. Most companies have come up with dosages that require at least 2. And I know that there's a company I've heard of that's trying to get it down to just 1 dosage. Have you heard anything about that?
Robert, we don't know. We are learning. We are trying to figure this out. If you think about the diseases that we know well, we have decades of research, decades of testing. Coronavirus has been around since about November, if we're being generous, but really December. It's become a known entity. And here in the US since February. So we got a lot of learning to do. So the best thing that we have in our back pocket is prevention.
Yeah, this is a marathon, and we have to. I've heard people talk about the fact that, hey, you just got to hold out a little while till that vaccine comes and everything will be fine. We don't know that that's going to be the case. We really don't know that, and you can actually have vaccines that are approved that you find out even after it's been released that maybe it isn't as good as what you thought. So especially through the expedited process that is occurring. So this is something that we have to really be disciplined as individuals and as families and as a community to really ensure that that people are safe.
Dr. Slaikeu and Dr. Bragg, I have one more question I want to ask before we're going to provide you with the opportunity to respond to questions from our virtual attendees. A lot of people don't get a chance to really hear how dealing with situations like this really impact physicians and health providers. And I would love to just get your thoughts. I know that you guys have probably observed a lot. We've heard about many people passing away, many people of color, African Americans passing away of COVID-19 in a hospital without being able to see their loved ones and say farewell to their loved ones. Can you comment about that in the impact to you as a physician and going through this experience with your patients? And I would also like to hear Dr. Bragg comment on that as well.
Yeah, so coronavirus hit me personally before it ever hit me as a doctor, because I'm originally from the east side of the state, so Southeast Michigan. So before we even had our first case, I knew over 24 people with COVID. Unfortunately, my husband's grandparents passed away from COVID. My brother and his wife were critically ill from COVID. My sister-in-law was on a ventilator for 16 days. Thank God everybody is better now in my family. So it kind of hit close to home quite early. And then in the process, we had the blessing of having time in West Michigan to prepare. And I really think that if we hadn't did all these extreme measures that we did with social distancing and kind of stopping everything and even shutting down surgeries and limiting visitors and exposure, we could have seen the same fate here in West Michigan that we saw on the east side of the state. And we would see Detroit still struggling. Thankfully, they are not. They've improved significantly. So for physicians, you know, it's just heartbreaking. It's hard. Medicine is hard in general. You know, you carry your patients with you. You leave and you still think about them. Whenever we lose a patient, you know, we hurt because we're humans. So to imagine seeing somebody scared from this pandemic that they are seeing that's killing people, or possibly they've already lost loved ones, and they're in a hospital alone, you know, you're their contact. So I know from a medicine standpoint, we try to go the extra mile to make those human connections, because in that moment, we're all they have. So it's difficult. It's difficult. And that's why, you know, I shouted from the mountaintops on my social media, wherever, do what you can to keep yourself safe, because several people are impacted in this in so many ways, whether you yourself get sick or your loved ones that can't be with you while you're sick, or, you know, us physicians that unfortunately have to be involved and care for these people that are in very, very tough situations.
Yeah, I would just add too that you know, the healthcare providers are you know, especially in ICUs, the hospitalists, those are caring for patients. I mean, this can be a trying thing for not only the healthcare provider but also their families, especially early on. There's a lot of anxiety for the healthcare providers around the impact on their life, on their families. At times, you know, isolating themselves from their families when they're, you know, when they're doing their work. These are all things that are trying, but they're also a part of the DNA and the training and part of one of the reasons why, you know, we go into healthcare is to meet people at their at their largest health challenges, and so it's a blessing to be a part of teams that are taking care of people with coronavirus, but it is an emotionally taxing thing for people, and it's something that I know at Spectrum Health we're really looking at. How do we support families? How do we and how do we support the healthcare providers, as well as our patients, because of the tremendous impact that this virus has on the healthcare provider as well.
Well, Sandra's going to ask you some questions that our virtual attendees have submitted. So I will turn it
Fantastic
over to Sandra.
discussion. We could go on for a couple more hours. This has been great. And the panelists and the participants are very engaged and interested in what you've been saying, and they've got lots of questions. We will not be able to get through all of them, but the first that I want to pose to either one of you really builds off of the vaccine question or conversation. You know, not only, you know, as you both talked about, is that process quite lengthy? Someone made the comment, you know, because it is lengthy, how comfortable would we feel even taking a vaccine that they claim they can get ready in a year? And then building off of that, another person asked the question, when I actually saw an article earlier today where they said that they're having a difficult time attracting people of color to even participate in the trials because of our history, right? You know, they don't want to be another Tuskegee experiment. So curious to hear your thoughts about, you know, if we produce this thing so quickly, how safe is it? And then how do we address the whole issue around people of color, in particular African Americans, just being concerned that we might be guinea pigs in something that's not even safe?
You know, I would just say that, you know, I'll just take it initially and I'll pass it over to Dr. Bragg, but you know, this is why it's really important to go through the process. This is why we have the FDA and the whole approval process in these phases, right? For how a virus, it goes, you know, we hear in the news people talking about, we need a vaccine right now, and let's just get it done. But there is a process so that we can protect people, and understanding we want to get to it quickly and soon. We do have to go through that process of validating the results of it, ensuring that people are not being harmed by the virus or by the vaccine. But you know, the studies can be limited, right? Even after going through that whole process, there still is a chance that you could find out that there are some other concerns down the road with a vaccine. But we have to weigh that with the fact that we have a very damaging, a lot of damage that occurs through contraction of COVID-19 in our population in the United States. I'll turn it over to Dr. Bragg for the rest.
So here's my disclaimer. I don't blame Black people, okay? We have a very dark history of medical experimentation in the US when you even go back to colonial days, where a lot of times African Americans were being experimented on to perfect medical procedures, yet they were not benefiting from the finished product. And that's really where the disparity come in. You know, you can't use me to test out these surgeries, but then offer these surgeries to white people only. And this is where we kind of got to start getting involved. You know, we need more African-American physicians, African-American researchers, so that there can be representation to assure equity in these spaces. So now that we kind of know this, you know, the idea that racism is still here and that healthcare disparities exist, that's a heightened knowledge, so to speak. There's been somewhat of an awakening since our attention has been captivated from everybody staying at home. Now we're paying attention to these things. COVID has shined a light on it. So now there's going to be more eyes on it. And I do have to say that as a people, somehow we have to get past that so that we are benefiting from a lot of these healthcare advances and not just being the experimental people. No, I'm not saying that's strictly the case with COVID-19, but when there is opportunities to participate in potential life-saving clinical trials, we need to do our best to obtain all of the information and truly get that informed consent where we're aware of everything that's going on and be able to make informed decisions together with our physicians. So that's just my plug. We need more researchers of color, but we also need more, you know, African Americans that are willing to participate in research so that we can be sure that things are for us. You know, that's the only way we're gonna collect that important information to move forward. So yeah, again, I don't blame Black people. So don't get COVID. So wash your hands, social distance, wear your mask, and all those other important things that we talked about.
Sure. Have you seen, and I'll just follow up with this with you, Dr. Bragg, have you seen any patients who have been diagnosed, they've, you know, made their way through and then have it come back? Is that typical or possible?
That is not typical. Again, we're still learning things, but theoretically, if your immune system is relatively normal, you get COVID, you make defenses against COVID. So you're not susceptible to getting it again. That's the whole premise behind vaccines to begin with. And even our experiment with the convalescent plasma that I talked about earlier. But there has been a few case reports that you may have seen in the media where people has had COVID, they completely recovered, developed symptoms again a period of time later, and tested positive again. It's just not enough people where that actually happens for them to figure out why. So if we're talking in general, probably not. Right.
Sure.
So it's still a very difficult question to answer because there's still so much we just don't know.
Sure. And, we've all been using that famous word pivoting, over the last several months. We've had to pivot in so many ways. How do you think this has impacted, a great question that came through, just the future of healthcare? We all know that there's this new normal that we have all had to embrace, and that will probably not go away. But how has that specifically impacted healthcare and healthcare on African Americans? Can you speak to that, Dr. Slaikeu?
Oh yeah, there are multiple ways that it is affected healthcare. One of the things I'd love to talk about just briefly, and that is economically the impact that this has had on healthcare. This is something that in leadership roles that Dr. Bragg and I are in, we're looking at that. The impact of just think about the impact of all the testing, of all the PPE, the protective devices and things to try to ensure that we keep the staff safe, and also the impact of the volumes that you see of patients and the types of diseases you see and can care for in a hospital. We look at over on the east side of the state, right? When we had when we saw that there was a peaking of the virus there, it was such a difficult thing for people to even take care of people because the resources were spent in other areas.
Right.
And we actually helped out at Spectrum Health with patients on the east side of the state, which I was really proud of us looking at the whole state of the community. But there's economic impacts. There's also there are many other impacts in terms of just how we view disease. Think about the impacts of people wanting to go into healthcare. It goes on and on. There's so many different impacts that this has within the field of healthcare.
That's great. And that question was actually asked by someone who is getting ready to make their way into the healthcare field. So they were just curious what's going to change. So great question. Thank you both. Fantastic, again, discussion. Had some more questions, but we won't be able to get through all of those. If everyone could just hang on for just another moment or two, our board member, Barbara Welch, just has a few more final comments before we wrap up.
Thanks so much, Sandra. And thank you again, Dr. Slaikeu and Dr. Bragg. The conversation was excellent, and I'm sure our guests have enjoyed it. I would like to just invite all of our guests tonight to consider becoming a member or making a contribution to NIA Centre by visiting our website at www.niacentergr.org, and just to show your support of this vision. If you've enjoyed the conversation this evening and you would like to see more of this, this just gives you a little glimpse of what we are working on as a board in becoming a world-class cultural center. So we do need your support and would appreciate that. So we have memberships from student memberships as low as $30 for our students, adult memberships, senior, family, and then our charter members. So if we have any of our charter members here with us tonight, we do want to just thank you for your support, and we look forward to seeing you at future events. We do have a few questions that we'd like to ask you all. So I'm gonna just launch a poll here for you and ask that you would take a moment to answer a few of these questions regarding your attendance at future Virtual Connect events and how you would rate tonight's event on a scale of 1 to 10. So I'll give you a few moments to do that. And if you have completed that, I'm going to leave it up here for a moment, but I would also like to ask your thoughts on future speakers. So when we started, our chair, Robert Upton, shared with you the pillars or our focus areas for NIA Centre, and we'd love to get ideas from you as to what types of speakers you would love to join us. So I think everyone has, looks like we have an overwhelming response that you all would like to attend other Virtual Connect events. And how would you rate tonight's event on a scale of 1 to 10? So I would like you guys to answer that. Give you a few more seconds here to do that. And if you could just go into the chat and share some ideas as to the type of speakers you'd love to have us invite for future Virtual Connect events. So I'll leave the poll up, and with that, these are the focus areas. Hopefully you can see those. Okay, gonna end that poll there. And if you could just put those in the chat, that would be great. So that is all I had to offer. And again, we just thank all of you for being here with us. And again, we thank our expert guests and just all of the information they were able to share with us. We have some pearls in our city, and we just are really appreciative. You know, we have opportunities to invite people on a regional, national level, but we had that same level of expertise right here in our own, very own city. And that's what NIA Centre is about, connecting the talent and the abilities that are represented in our city to our community. So thank you so much.
Thank you both.
Thank you both.
It's
Fantastic.
fantastic.
Thanks for having me.
Yeah, thanks for having us.
And everyone have a wonderful evening.
Absolutely.
Thanks,
Good
everyone.
night.
Good night.